It varies actually.
Okay.
I've had patients who sort of spray it on one end and then kind of like just breathe it in kind of thing.
Okay.
But the onus is on the doctor or the nurse to explain these things to the patient. Because if I want to give you a complicated device without any instructions, then of course you're going to kind of try and use whatever method that comes to mind to use it. So in this day and age, of course, you've got the internet as well. So you've got things on YouTube, you can quickly look at things. But really it's about getting down and spending time with the patient to actually figure out how to use it properly. And then you may find that the treatment needs to be changed. Because, for example, some of the inhalers require you to press the button in order for you to get the medication in. But if you're fairly old or if you've got arthritis, you may not have the strength to do it properly, or you may not have the strength to actually hold your breath and breathe in. Then you may decide that, okay, let's try a different inhaler, or sometimes you use something called a spacer, so like a chamber device where you spray the medicine into the chamber and then breathe things in. In fact this one, yep. So like this thing, you can put an inhaler here, press it in, and then you just get silence and breathe normally. So that, it boils down to the fact that you need to spend time, get the patient to understand the rationale of using these things, and then get it used regularly. And sometimes we get parents coming in telling us that actually we don't want our kids to play sports or participate in sports, so can you give a letter saying that they should be excused? But the reverse is true, because you want people to actually be more physically active. More physical activity actually improves the health of your lung. There are no supplements, there's no magic tablets to make your lungs healthy. It's good old-fashioned physical work. And I remember reading about our national swimmer, Welton Sin. So he apparently took up swimming because he had asthma. And he's obviously done very well from it. But it just goes to show that actually you shouldn't let the asthma control you, but rather you should do what it takes to control the asthma. The reason someone might feel that way is it may be that because they need something stronger at that point in time. And like I mentioned before, sometimes they may be referring to the blue inhaler. So if you're using a blue inhaler frequently, then actually it may mean that you're not addressing the underlying inflammation and things are getting worse. And after a while, if there's too much tightness to the tubes, you may find that it doesn't make any difference. So it may be how you approach things that make a difference. So by right, in theory, your blue inhaler, the reliever, you shouldn't be using it more than twice a week. If you're using it more often than that, it tells you, or it tells me as a doctor, that the asthma is not well controlled. If someone's buying more than one inhaler in a year, that tells me that you're overusing a blue inhaler. And to me, that's a warning sign. It means that you need to use your controllers better, or I need to improve the degree or the dosage of the controller inhalers so that you use less of the blue ones. No, unfortunately, once you have asthma, you're kind of stuck with it. What changes is the susceptibility to things around you. So as a child, especially when you're growing, you get exposed to all kinds of new things. You get attacks, recurrent wheezing episodes, and then eventually the frequency goes down. But you do find that some people eventually, as they get to a certain stage in life, that some of the symptoms come back. It's just that because the threshold has changed and because the immune system has been modulated as well, they don't get it as frequently. But it's more about things being less severe rather than it being completely gone. Because you get folks who have got life-threatening episodes, who get admitted needing ICU treatment and things like that, but having come off it and then having been on the right treatment, they actually can get better. So the ones who are very difficult to control, the ones who need multiple medication and things like that, the numbers are actually very small. The vast majority of folks are actually folks who need just a little bit more attention when it comes to the type of medication, and once again about the regularity and the accuracy of how they actually get the medication in. The preventers, yes. So the relievers, the blue one, they don't. But the preventers or controllers, they have a tiny amount of steroid in them. Because steroids are the best drugs when it comes to decreasing inflammation. But I think going back to what you mentioned about myths, sometimes people are worried. They think, oh my god, steroids is going to destroy my kidneys, it's going to make me fat, blah, 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 blah. But steroids, once again, it's a group. And they're different types. You've got inhalers, you've got tablets, you've got even IV steroids. Now, the side effect profile of each are actually quite different. If you were to use tablets, for example, and you use it frequently or often enough, then yes, you'll get all the side effects that you will worry about. But inhalers, they tend to go straight to the lungs. And the dosage and the formulation is extremely different. So you actually get very minimal systemic effects. It goes to the lungs, it helps the inflammation. And the steroid inhalers are the ones that save lives. They are the ones that actually control the asthma. in fact, by controlling the asthma with inhalers, you actually reduce the risk of requiring the tablet steroids. So if you don't use your inhalers properly, you might end up needing more tablets, which we use for more severe cases, and then you end up having side effects. So one of the reasons for using the inhalers is actually to avoid all the side effects from steroids. If we need to use it, we don't want to use it unnecessarily. So if you have a cough that's been going on for more than 3 weeks, I think you should see a doctor, because asthma aside, it could be something else. It could be TB, it could be cancer, it could be anything. But if you do suspect yourself or even your children as having symptoms in keeping with asthma, then do see a GP. Most primary care doctors, most GP doctors, they're very familiar with these conditions, these symptoms, and if necessary, they can then refer the patient on to a specialist like myself or somebody else. The other thing, of course, is the information online. You mentioned earlier on about the misinformation, and we've gone from not enough information to too much information to the point where we can't figure out what's right and what's not. So go to very clear, trusted sources, and we have an organization called Asthma Malaysia. So if you go to asthmamalaysia.org or you follow the Facebook page, you'll get lots of information there that we hope is very geared and actually directed towards the Malaysian population. There are other very good asthma sites as well. There's Asthma UK, Asthma Australia, and they will give you very good details about the symptoms, what to do if you're worried, the different types of inhalers, and basically all of this is geared towards empowering the patient so that once you have asthma, or once you know you might have asthma, you're not afraid. You don't get held back by all these myths, and you can actually have a normal, decent quality of life.